I think this is a good time to do some side-lying position work. The way I usually do it is to just scoot this bolster here and tell my client to, roll over and face me. Hey Jen, I'm gonna hold the sheet in place. It's anchored on this side and I've got it held over here. So if you can just roll towards me and then possibly... yeah, like... Oh, I'm sorry, no, to your right. Keep your bottom leg straight and then put your right leg sort of over this bolster. Okay. If you can make it kind of at a right angle, that would be ideal. Would you scoot down just a bit so that your head will be all the way on the table? I basically want to make sure that like her spine is in a straight position and that her shoulders are stacked on top of each other and that her hips are stacked on top of each other and that everything's kind of at a right angle, like her hip is at a right angle, I mean. So that'll just make it easier for her to stay balanced and also will keep from, her sliding around on the table and also keep her from running into any kind of strain or uncomfortable position, ideally.
And so the reason I do side lying is it's really great for getting low back work. It's really the only way to get this part of the body massaged really well. And the what is this?
Well,
the iliopsoas, I think.
Yeah, and the tensor fascia, the TFL.
Yeah, and we don't want to poke around on it because it's a very sensitive area. It gives you really good angles for getting other muscles that you just can't get when you're face down or face up.
And draping, of course, you want to be kind of, cautious with. But what I'm going to do for that is to hold her knee kind of securely, just lift it up off the bolster enough so I can tuck the sheet under her thigh like this. Then, she can even hold that and pull it if she wants to feel more secure, but then I can, expose part of her leg that way.
So I love what you're showing us with all this. What I usually do is just kind of bunch it up and then tuck it.
That's really good.
Because I don't want to disrupt the flow of the massage too much by doing all of that. But I mean, there's a lot of value in doing that, and I think it feels really nice. When the diaper drape kind of feels like you're wearing a cute little diaper.
Yeah,
it's really secure. It's really nice, but from my end, it just kind of disrupts the whole flow.
That makes sense.
Yeah, and so I just try and hope and that people don't feel uncomfortable.
Yeah. And some people are going to be more comfortable with, more skin exposed than other people, of course. So you just have to gauge that. But yeah, it really doesn't have to be that hard to keep, all the private areas, modestly covered.
Yeah.
So then I like to go, use this position to do some stretches. Like if you push the leg down like that, it kind of opens up the hip, stretches the glutes and everything in there. How does that feel for you, Jen?
Feels good.
I really like that.
It's light, but it's there.
Okay. You could go further, I think?
Probably, but... Yeah.
Nice. And then I can, straighten out the leg, and then sometimes I like to just anchor the bolster with my knee and kind of work the hip back and forth. But I'm not really sure. I need to get somebody to do this to me one of these days.
Oh, that's right, yeah.
Just to kind of see if this feels like I think that it does.
Isn't that the one that I said felt really awesome and you hadn't experienced it?
I think so, yeah.
Yeah.
And then when you have the leg extended like this, you can flex the toes, or extend the toes rather.
Yeah.
And I feel like that, deepens the calf
that
stretch.
got my calves really. Yeah. How do your calves feel?
That's not stretching them.
Yeah.
It's not really stretching them.
It's not.
Yeah, your lower leg seems pretty dang flexible. So yeah, I feel like side lying position is good for those kind of stretches. You could also just do this kind of stuff. I feel like this is really good for kind of reminding the hip flexors about the range of motion that they have. Sometimes our muscles need to be kind of reminded of their range of motion, right? But also, I think that you mentioned you can use a lubricant to work on the IT band. That can be really helpful.
Yeah, I really need to practice the draping that you're doing because it allows you to do a lot more stuff with the leg than the way that I drape.
Yeah. Yeah, I think I was kind of zonked out when you were doing my draping and sideline positions, so I don't know how different it is.
Yeah, oh, it's pretty different because I don't pull the sheet under the leg. I just like bunch it around
Oh,
and
yeah,
kind of
yeah.
like tuck it.
Okay, right. Or,
But another thing you can do is draping is you can kind of hold the drape as you're working on it.
yeah, that's
So
true.
I do that with my method. Is, if the sheet starts opening itself up, I just kind of grab it and hold it.
And this is maybe a little bit more sensitive for the client, but you can like roll up or get the sheet out of the way here and then work those adductor muscles.
Yeah.
But that's really sensitive. And
Yeah, I don't think I do that much because it just I don't think I like it on myself, so
Yeah.
I just don't do that. Yeah.
I think that there are probably better ways to work the adductor
Yeah.
muscles.
Yeah, with them when they're face up and
Yeah. And when you're lying on your side, I don't know, maybe I overthink it, but I feel like when the client is lying on their side, to do a motion like this just seems a little bit invasive.
Yeah.
So I like
Yeah.
to do adductor work when my client is lying facing up.
Yeah, pretty much what I do with side lying is the lower back, and if they have shoulder.
Yeah.
There's a lot you can do with the shoulder face up and face down. This is like the only way to get this part of the body.
Pretty much.
And you can get everything else like face up or face down pretty much.
Yeah. You know what I like to do? Well, it would be hard. You would have to totally reposition her. But I would like to show you that side-lying psoas stretch where you pull the leg behind, but I have to stand on that side of the table. So, I mean, I can show you what we're talking about. I'd have to, do the draping securely over here. I think that would be okay. But then I have to sit on the table behind her.
Really cool.
And I can smile at the camera when I do this, right? And pull her leg. Oh, I'm sorry.
That's all right.
Yeah.
And that's only because I'm a person over here. In a clinic, you just wouldn't. But those little things do matter for clients. Like even if they know logically, no one can see.
Oh, sure.
It's like it's just feeling that draft of air on your private areas.
Mm-hmm.
Just kind of. But yeah.
So, once again, your legs are pretty flexible, Jen. But do you feel a good stretch in your?
Yeah, I feel the stretch.
Yeah. I need that when I go on a lot of biking,
Yeah.
That can be tough on my quads and psoas and stuff, So I like to do that with, people with hip flexor issues. And then the other side-lying, position work that I can think of to do, remember when I pulled your shoulder behind you and worked on your bicep that way? But then, pulling the arm up this way, I think is really good stretch for the lats.
Yeah. And you can do that when they're face up too, but it does seem. How do you feel like it's different side versus face up?
Oh,
I think it gets more of the lats when you're on your side, whereas when you're face up, it's more like
more
triceps.
like in pecs maybe.
Yeah.
I don't know. I actually think this is a really good stretch for the pecs too.
Yeah.
And so then you can also kind of work on the subscapularis that way. And be able to move around the shoulder as you're getting under the shoulder blade. But then, this stretch is especially really good for the anterior deltoids here and the pecs and the bicep. Yeah. Oh, and then, don't forget we can go in this direction too. I do feel some restriction there.
Does that help with the bones at all as well, or is it just like a muscle stretch?
Yeah, it's really just a muscle stretch. And then, you know, but if the muscles are too tight, then they're going to be holding the bones in, you know, a position that might cause nerve impingement or something. But, yeah, we're working on stretching the muscles that are holding the skeleton in a,
As
you know.
massage therapists, we're not allowed to touch on bones.
Yeah.
Yeah.
We're-
I didn't know because you know pulling on the arm if it's like helps with
Yeah.
any kind of tightness, and you know, or the socket
Yeah.
or something like that.
It's good. It's going to be good for like alleviating pressure inside in the
Yeah.
muscle socket.
Yeah.
I mean,
Yeah, all
in
the
bone.
tissues
Yeah.
are,
Yeah.
all the tissues that are connecting things.
Work along the spine. I mean, this is you can work on sciatica this way just by. Oh wait, sciatica. Never mind, that's hip.
Yeah.
Oh well, in that
I have
case.
rotator cuff issues though.
Oh, yeah?
If you, yeah.
Yeah, I thought so.
Yeah.
Sciatica, you'd be like working on lower back, and you could like, you know, like. Yeah, I'm pretty sure
Yeah.
the piriformis is the most likely
Yeah,
suspect in
and that's up here, right? It's
sciatica.
like amongst the glutes.
Yeah.
Yeah, it's like between the greater trochanter and the what is the piriformis attached to? I can't think about that
Is it
under
the sacrum?
pressure.
Is it the sacrum to the?
Yeah, I think it's the sacrum to the greater trochanter there.
I know the nerve runs right under it, and if that muscle gets inflamed, that's
Yeah.
Basically
that'll
right
push
in
it.
there.
Yeah.
You could really work on this kind of stuff, like draped or undraped, with like, you know, rocking around some pressure in there. I mean, at least as an introduction. Oh, I just felt it kind of spasm a little bit.
Or do you want to go over rotator cuff since you're just working on the
Yeah,
shoulder?
sure.
Yeah. So
I don't really do a whole lot of rotator cuff necessarily work in sidelying position,
Right,
but you
yeah.
can do this kind of stuff and let me think of a better way to hold this.
So as Dr. Mike says in one of his YouTube videos, you kind of want your well, we're not doctors, but you want your doctor to like look up the latest things. Like it's not embarrassing for them to look at a YouTube video before they treat you, because they're making sure they're
Yeah.
up to date and like